No. All right, we're going to call the meeting to order, and I'm going to hand it off to, who's doing roll call? Stephanie to do roll call.
Member Barish? Member Ebium?
Here.
Member Doherty?
Here.
Member Miller?
Here.
Member Ansel?
Here.
Member Almond?
Here.
Member Muschetti?
Present.
Member Bradley? Bradley?
All right, we're going to open it up to public expression, and we will allow the public to have 3 minutes each to come up and speak about anything that's not on the agenda. So it's non-agendized items. So if we have anybody who would like to speak, please come forward. Please state your name, and then you're welcome to speak. Thank you.
And I just wanted to address this group briefly. I timed this. I can't guarantee you it's exactly 3 minutes, but I assure you I come in peace. So it's in 2018, the Kemper Report tasked Measure B with the objective of creating an adequate level of continuum of care for county residents to comply with Mendocino County's ability to contract for Medi-Cal organized delivery system, or a regional version of this model, in accordance with the ASAM for substance use disorder treatment services. The report outlines 9 service areas required in the continuum of care. This includes early intervention and intensive outpatient and outpatient services as key building blocks of a healthy system. A social model detox works in conjunction with a medical detox, with medically assisted treatment and narcotic treatment services supporting detox treatment services. Residential treatment recovery services, case management, and recovery housing all provide higher level service area. Leaving out any aspect of contributing agencies does not maximize their potential for the necessary continuum of care required in approaching this large problem. With a comprehensive coordinated level of continuum of care for SUDT in mind, Kemper Report suggests expanding the ASO and program management operations to provider credentialing, contracting, quality assurance, compliance, and oversight, and policy direction, as well as identify and contract with an array of SUD contractors for new service delivery. In calling different organizations who are eligible to receive the IRP, we identified at least 35 organizations that perform SUDT services in Mendocino County. These agencies include Mendocino Coast Clinics, New Life Clinic, Adventist Behavioral Health, who have substance use navigators at clinics that work with each hospital, RCS with crucial programs such as Arbor and Stepping Stones, NAMI, who has been tasked with addressing cultural disparities in our mental health system, McCavan with harm reduction models, Hospitality House and Ford Street, Consolidated and Yuki Trails, Mendonoma, Point Arena Clinic, and many more. We have the components for a multi-service level robust SUDT system if strengthened. Additionally, with this first round of funding, Mendocino County will still not achieve the dual diagnosis that we so strongly need and the medical detox that we need as outlined in the Kemper Report. The Kemper Report suggests Measure B utilize 10% of its funding for SUDT in the first 5 years with subsequent funding through the next 5 years. While the current released RFP will only award one proposal, today's financial report included nearly $12 million in unallocated Measure B funds. In addition, $5.5 million remains unallocated from the Crisis Stabilization Unit, and which the committee chose not to fund at this time. In addition, the state has awarded $9.3 million for the building of the Whitmore Lane Health Facility, and we have $26.5 million available. I suggest a second round of funding for funding of $2.65 million with Measure B funds that not only supports the Kemper Report recommendation, but also is possible given the level of service for Measure B funds.
Perry, we're going to need to have you wrap it up.
With this in mind, I suggest that Measure B Advisory Board consider releasing a second round of SUDT funding and/or proposals for many organizations previously mentioned in another RFP. Feedback from the community organizations suggests technical guidance, perhaps a seminar, and assistance through the county to make a robust array of proposals. I humbly request that the board consider this proposal, and I thank you for your time.
Can I get a copy? Can I have that copy?
Absolutely.
Thank you.
I only brought one, but I'll send it to you.
Okay, perfect.
That's all right. And this is the list that I have so far.
Thank you.
You're welcome. Thank you.
Any other public comments?
Hi, my name is John Wetzler. I live here in Little River. I had the honor of being the chair of the Behavioral Health Board for about 6 years, about 3 or 4 years ago. I'm very gratified to see the progress that this committee has made. When I drove down State Street and saw the Whitmore facility gone and that big slab there, I said, that's really good, and I'm very happy to see that. That's the main thing I wanted to say. And the other thing I wanted to ask about was the crisis stabilization unit. Is that still in the works? That's a question. And then the ride-along care for people I don't have that in front of me. What's this? Mobile crisis units responding to the calls. There are concerns that may not have enough equipment or staff responding to crisis calls. So that was of concern to me. So I just wanted to hopefully have those addressed somehow. Thank you.
Thank you. Any other public comments? All right, hearing none, we will move on to committee matters. The first matter is approval of the minutes from the June 28th, 2023 regular meeting. Any comments, questions, approval?
I've read them, and they look good to me. That's how I remember. I'd like to make a motion we approve the minutes as submitted.
Do we have a second?
Second?
We have 2 seconds. All right, any committee member comments? Any public comment? All right, hearing none. Stephanie, can we do a roll call?
Member Ebiam? Yes. Member Doherty?
Yes.
Chair Miller?
Yes.
Member Ansel?
Yes.
Member Ullman?
Aye.
Member Moschetti?
Aye.
Member Bradley?
And the good doctor is here.
Yeah, please note, Dr. Barash has arrived. All right, we will move on to item 3B, the August 2023 Measure B Financial Report, and I will hand it over to Mary Alice.
So, good afternoon, everyone. I did want to send my apologies. I forgot to, last month, the committee had asked to include a copy of the proposed budget for this fiscal year for Measure B, and I did not include that in the packet, so I've handed one out to everyone, and then if you need one in, for the public, there's a stack of them over there, because it's not in the agenda packet. So I did bring that today. As far as items to note in the reports that were sent out, our revenue is posted through the month of May, and then the June revenue and Q4 interest should be posted hopefully by the end of this month, so that'll be in next month's report. Another, I think, an item to bring to that we went over budget in this year was our A87 cost. When the previous year, our costs were about $18,000, and we usually budget those according to that because we don't, about what we paid the year before, because we don't get those numbers until usually the end of October. And when we got our invoice in June, it was a lot higher than normal, so it's about $48,000 more for A87.
Will we be able to see that invoice?
Yeah, I actually, yes, I could give you a copy of that, yeah.
the whole purpose of AE7 is for us to reimburse the county for their services.
Correct.
And I thought we had agreed upon which services those are going to be and how much. So if we're getting billed at a much higher, your word not mine, rate than, or for services that we hadn't planned for, we need to look at that.
Well, so I know we get billed the direct charges, and then there's also the indirect for the overhead of all of the services for those agencies, like facilities. And that's where our largest cost is. The increase that I saw was in the facilities charge. We do get the direct charges, but then we also have to pay the indirect for that operation of facilities. And so that's where, and they do deduct off the direct charges that we paid.
Okay, thank you.
So and that's where the biggest change, and that is also in April of last year is when we started the CRT and the training center were both, new buildings that facilities is now having some part of maintenance on them. And so that's where that is. But I can get you a copy of that. I don't see an issue with that. Yeah. I think that's all I had, unless you have any other questions regarding the reports that were put out in front of you. And I will say, I don't have, next month in September's report, I will include the first report for this fiscal year. There was like one charge that had hit that budget so far for this year, and I figured I would start that report up next month. So next month we'll get hopefully the closeout for 22-23, and then your first fiscal report for 23-24.
Have we received 100% of the, in April 1st when it changed from the half cent to eighth of a cent, is that, has the state given us all of that amount and we're just only seeing the eighth of a cent now?
We're only seeing, correct, they have, yes.
Okay, thank you.
And the last payment is June, and right now we're coming in right at about 200,000 under the 8 million that I budgeted, so I'm hoping with June's payment that will kick us up to that 8 million that I budgeted, so, yeah.
And we don't have any idea yet, because the 0.1% went into effect, I believe, April 1st,
Yeah,
yes?
mhm.
April, May, June, so 3 months. We won't get those numbers for another
I know,
couple months.
we've
yeah.
already started getting some of them. If I go to, let me just look at the revenue page really fast. Let me find that. And it's been somewhere between, so it's like, in the first month was 190, right at 191,000, and then for May's, we received 229,000.
Great,
And that was with the decreased percentage.
Right.
Yeah.
great, thank you. Was that in here?
Yeah, it's on page 2. Page 2 in the back. It shows April and May's at the very bottom of that, at the very,
Oh,
very
yeah,
first, yeah.
great.
I just have to say, because I say it at every meeting, the numbers you're providing us are so much better than we used to have. And
Well,
they're
thank
easy to
you,
read.
Tom.
Thank you very, very much.
Thank you.
Any other committee member comments? Hearing none, any community member comments? All right, we will move on to the next agenda item, 3C, update and discussion regarding Measure B related items at the Board of Soups meeting. There have not been any updated Measure B items going to the Board of Supervisors meeting. We will have some items going in September. As some people may know, the board is in recess throughout most of the month of August. And so we do have the tables that will be going to the board, hopefully in September. And then eventually when we finalize the RFP evaluation, that committee is reviewing them now, we'll be bringing that item forward. Any comments? Questions? Public comment questions? All right, hearing none, we'll go to the next item, and it's update and discussion regarding the status. God, our things are not working. Regarding the current Measure B projects. And you guys have the report right in front of you in your packet. We continue to see more interest in the Behavioral Health Regional Training Center. We've had some additional use over the last.
Donna, give her your microphone.
Test. Dr. Miller, I have a quick question. I think it falls into item 3C though, about the Board of Soup meetings, the updates. There was a timeline for the RFP. Is that still the original timeline? Is that still in place? Has it been changed? Where are we with the timeline for that?
I can't speak to that. I'm not part of the RFP. Karen Lobato is sitting in my place, and I think I know that the committee did meet, and then there was a concern that's been brought to county council. Okay. And so I think once that concern is addressed, the committee will continue to evaluate. So I know there has been a concern brought to county council.
Okay, thank you.
So I'm sorry, Sherry was reading my notes apparently. Because in 3C, the update and discussion, the RFP, and I'm sure that's why Jackie's here at the status of the RFP. Can you tell us anything about where the RFP is? I mean, with our opening letter, our speaker.
Tom, what I can tell you is that they had a first meeting. There was some concerns that came up regarding the evaluation and evaluators that have put that project on hold. And so county council has been brought in. So that's the best I can say right now.
And and I understand that, so can we just assume that next agenda, at least we can have it listed as an agenda item, the status of the RFP?
We can definitely do that.
Thank you.
Thank you.
Okay, so regarding the current Measure B projects, as I noted, the Regional Training Center, we started to see a little bit more use, which is good. We will be bringing the request for 8 additional tables to the Board of Supervisors in September. That was a request from the Sheriff's Office needing more tables to do the crisis intervention trainings and some additional trainings out there. Community education awareness and support, as I had announced that NAMI is no longer going to, is not planning to renew their contract this year. They will term out, I think, September 30th? August 31st. But I will let Donna give an update. NAMI has been doing some stuff, so do you want to give an update on what you've been doing?
Sure. I think I speak loud enough. You can all hear me, yes? Yes, we are still working with, I guess you'd call it cultural diversity, with the Native American community. We had a meet and greet August 9th, and it went very well. We had 17 people there, and we have 3 Native Americans trained in NAMI Family to Family, and we're trying to bring NAMI programs to all of the Native American communities, and we're going to conference actually they left today, and we're hoping to get connections with NAMI Spanish speaking to help get into the Spanish-speaking community and learn how to establish trust there. Because it's all about trust. It takes a long time, takes a lot of effort, but it's worth it. So that's where we are, and that's what we are doing right at this moment. And if anybody has any questions, I'd be happy to answer them.
At the end. All right, crisis assessment and psychiatric aftercare, those services did start back up through Measure B funding July 1st. We do have, their contract was approved for 90 days by the Board of Supervisors, so we'll be bringing that contract back September 12th and hope that the board will finalize the whole year of contract so that these services continue. There was a little bit of a concern that they ran out of money before the end of the year. That's how many people are accessing this service through Measure B funds, and those are specifically for individuals that have private insurance and Medicare and veterans, and some a little bit that are indigent, which means they have no insurance. So there is a high level of individuals that are accessing these services. They did run out of funds early, so we may hear from them for a request for some additional funds so that they can treat everyone through a full year and not have to stop serving those individuals. The crisis residential treatment facility is still obviously up and running, and they're still working, and they are full off and on. They do reach capacity quite often, and I know we, from the behavioral health side, have asked to use it on a couple occasions and needed it, and it's worked well, and there's times we've needed it, and it's been full. So it's definitely operating and meeting the needs. Fort Bragg Crisis Respite is up and operational, which is very good. I am hearing it's working well. I think the chief is here, and he might have more to say on that. I think he's very excited to have it. And for mobile response, there was a question regarding, we would like to increase the number of staff we have. The conversation about equipment is that the mobile teams are sometimes called out to calls with an active shooter. And there's been conversations about should they have bulletproof vests? What does that really mean if you're putting crisis workers in situations and they don't have all the safety equipment? And that's the conversation that's being had regarding that. The audit, I know that I'm hoping that the ad hoc committee for the audit is going to have a meeting very soon. I don't have any feedback on that. And then psychiatric health facility, Mr. Wetzler commented, the facility is completely gone. It is bare ground, which is really exciting to see. We're really in the next phases of working on finalizing the plans and getting ready for construction in 2024. And as we know, we were awarded an amazing opportunity from the state to fund that project with $9.3 million. It is a lot of work. That grant will be a lot of work, but it is really thankful to be awarded those funds and have this ability to augment Measure B funding. Any committee? Yes.
I do. So I'm certainly hearing rumors that the south end of Ukiah has a group of citizens who are not supportive of this. And is that going to slow the progress down of the project?
So I represent District 5, and I live in South Ukiah, and I think, yeah, there has been some concern among some of my neighbors, you know, as to be expected. But the way that the facility demolition has gone down has been so streamlined, respectful. There's a lot of good communication going on between the contractors and the residents in the area. And I think it's just going to take some time for people to see what the reality is and get over some of the maybe more irrational concerns they may be having.
Thank you.
Any other committee member comments, questions?
I have a question.
Yeah.
About this, the PUF. I know it's just bare ground at this point, but can you refresh my memory? What's the expected or estimated date of completion?
It's a moving target, Sherry, so I am hearing end of 2025, early 2026.
Okay, and will the contract, I know there's been a contract submitted to run the PUF, that the county won't be running it, correct?
Correct. The county did a request for qualifications, and from that, Telecare was selected. There has not been an actual contract with Telecare because there wouldn't be a contract until we're actually hiring them to operate it. So they're waiting till when the PUF is ready to operate, they'll sign a contract. Telecare has been in the construction meetings all the way through and have been consulting with the architects and everybody free of charge. Providing their construction people free of charge to give advice on, they have their own construction team, they build their own facilities, they have facilities in multiple states, several in California, and so they have been participating pretty much from day one of them being selected as regarding here's what you need, here's what we think, free of charge. So they've been a part of the construction.
Does the Measure B committee get to weigh in on that contract in the sense before it's a done deal that we can read it, or what's the protocol?
For the operations contract, that will go in front of the Board of Supervisors for final approval.
Right, does it come to us before the board?
Not normally. We definitely could, but it's really hard to find a psychiatric health operator. And so there, we'll be working with them on that. But I mean, you guys can definitely see it if you want. There's no reason we can't come here first.
Yeah, yeah. I just think it gives us possibly information for planning purposes, financial planning purposes, possibly. That's all. Thanks.
Sherry, I'm familiar with Telecare. I've had to use their services in the past, and I'm ecstatic that they're the ones going to be working with us. And I'll tell you about it if you want. You're welcome to call me.
Yeah, no, I don't question Telecare per se. I guess we've talked on and off about possibly renting a couple of the beds in the PUF, possibly to Lake County, on an ongoing basis, that they would pay for the use of maybe 2 beds, 3 beds, whether they used them or not, they would pay for them. And for planning, for financial planning purposes, that would be useful to know what the plan is around something like that, for example.
And I think that conversation will be up to the county to decide if they are going to decide to, one, is Lake County interested in paying for what they call bed days, right? Like having a bed
Right.
day.
Right.
It's a practice in the behavioral health field to pay for a bed so you have it available 24/7. You pay for it whether it's being used or
Right.
not. If it's not being used, they can ask that county, hey, your bed's not being used, can we give it to another county? And then they don't charge you for those days. So that will be a county decision, not Telecare.
Right,
Right.
right. But is that something Measure B would weigh in on as a recommendation or not?
I think Measure B can make a recommendation, but it really will be a operational, behavioral health will have to look at the operational. And we also need to do, before we weigh in, we really need to look at how many clients we have needing access to those beds, how many
Right,
days
right.
per month. Can we afford to give up a bed or
Right,
two?
right.
Or will it mean that our own citizens will have to go out of county? And that's what we want to prevent. We don't want to make it so our citizens are going out of county because we have another county using our facility.
Yeah,
So I think there's a lot more research that has to be done and stats that we need to look at. We can look at it, we can look at it, but from prior history, that'll give us some information, but the number of hospitalization changes yearly.
right,
And so we'll need to do some history look to see whether it's even an option.
okay. Thank you.
Any other comments, questions? None? Public? Yes?
Are we still at 16 beds? Is that what it's going to be?
Yeah. Yeah, so yes, the facility is a 16-bed facility that is due to the IMD, Institute for Mental Disease, exclusion at the federal level. There is a possibility for a waiver happening in the state of California. We don't know how that will or won't work and whether or not it will even be extended if it gets passed. So at this point, we really are looking at a 16-bed facility, which will allow us to accept Medi-Cal for the ages of 22 through 64 and not prohibit the use for anybody. And then we are building what's called a super puff. While it's called a super puff, it doesn't mean it's stronger or better. It means that it meets the standards for Medicare, so that Medicare can be accepted at that facility, and that usually will allow private insurance to also be willing to work with that facility because Medicare has one of the highest standards. So. Any other public comments? Can you guys come to the mic and state your name, just so, because for the people that are online.
Perry Keller.
Thank you.
The only thing that I might suggest is that you have meetings, you hold community meetings periodically throughout the erection of the building and the project rollout. It will make your community more cohesive and more involved and more invested in the project, and I think it will be an easier outcome for you. Just a suggestion.
Thank you.
Thank you for your feedback. I think we knew to some degree that no matter where the building would go, there would be some resistance, right? So thank you for your suggestion.
I'm sorry, I'm back up a ways. I'm just wondering how I'm to communicate the suspension of the request for proposal. Just that it's suspended until
I won't say it's suspended, it's still an evaluation phase is what I would say, Jackie. And I'm hopeful that they did have their first meeting and they're waiting to have their second meeting. So I would just say it's sort of it's still an evaluation process.
Are you
but-
able to describe what the conflict was that was communicated to county council that led to this?
I don't know that I can do that without county council.
Is county council on the line?
He's not, I can call him in though. No, he said we could call him if needed. You want to talk about the crisis respite and how it's helping Fort Bragg?
All right, thank you. Chief Cervenka with Fort Bragg Police Department. Yes, the respite is working wonderfully, unlike the stand. Show must go on. So and with the people that are against building a PUF, there were people against building the respite where it was going to. There's always people going to be against it, but I can say with our respite, nobody even knows it's there. It blends right into that neighborhood. It's been wonderful for RCS to be able to move people throughout the county because sometimes a cool ocean environment away from what they know in Ukiah is wonderful for their rehabilitation. And vice versa. Sometimes it's good for our Fort Bragg folks to be able to be moved to other locations as well. So kudos to funding that respite. It's been a huge help for our community. Thank you. Sorry I broke your stand.
I have a question for the chief, if possible. Chief, welcome. We're glad you're here. We really are. Not just here, but in our county. So when Measure B was first proposed, one of the strongest talking points was to free up our hospital emergency rooms and law enforcement from having the 72-hour commitment done in the hospitals. And obviously, citizens say they may have an emergency also, but the beds were taken by mentally ill victims. So now that you have a little bit of resources, as in the respite, you don't have as much as you're going to get, but you have a little bit. Has there been any kind of relaxation of the stress that our hospital on the coast has been feeling?
You know, that'd probably be a better question for Judy Leach, president of Adventist Health. I can say going to law enforcement executive meetings with Sarah Livingston from RCS, we are in Fort Bragg, and it might not necessarily be because of the respite, it's because of our crew team, and our crew team handling a lot of those mental health cases on the front end before they turn into a 5150. They're able to get them into resources before they have law enforcement contact. The respite is full. So as soon as it opened, it's full. So, and moving those people around, I know that we're not, I don't think we're taking as many 5150s to the emergency room anymore, just because of the training and our crew team that's able to intervene before it gets to a point where it's law enforcement's getting involved.
We're accomplishing our task. Thank you and your team for that. Thank you.
Any other public comments? All right, back to the committee. Any other comments or questions?
I just wanted to say to Chief Cervenka, it's throughout, I've already heard it disseminate down the coast that what's happening up there has made a difference in the community. And I appreciate that for sure. Thank you.
Could you tell me anything about the average length of stay? At the medical respite.
I could not.
Just curious. Thank you.
All right, so we'll move on to the last item, committee member report outs. Stephanie?
Member Barish?
Nothing to report.
Member Ebium?
No report.
Member Doherty?
No report.
Chair Miller?
No report.
Member Antle?
No report.
Member Ullman?
I'm a member of Rotary, and Rotary for our district has prioritized mental health towards the teens and mental health awareness. And there's actually an ad hoc committee which is involved with Sonoma County, Lake and Mendocino. I'm hoping that our next meeting, one of our representatives from Sonoma County will be able to explain what technological programs Rotary is paying for the community. Maybe it could be an app on their cell phone for immediate mental health or just knowing resources. And to our speakers, I want to thank you for the letter, but I hope you understand that if we haven't even got to the point of, and I understand your letter, for your substance abuse increase in funding, a couple things. Government has never been able to stay on budget, and I would welcome someone to prove me wrong on that one. And just because we have we have adequate money right now doesn't mean we're going to have an overabundance of it. But we're very careful. You know, the wording in Measure B prevents some government organizations from taking money that they've taken from other voter path bonds. There's very little administrative fee in Measure B. So we really can't answer your question regarding putting a coastal substance abuse place as much as you need one. I would say until we at least get past the hurdle of getting the first one, that in Fort or in Ukiah, that all we know is there's at least more than one responder to the RFP. So what you say is golden, and I appreciate the letter, but it's just going to be what government always says. You have to be patient on this one. But we know what the voters said in Measure B, and we're hoping to get to that point. But thank you.
Member Biscotti?
No report.
Member Bradley?
All right, then we will complete the meeting. Thank you, guys.
Is there an opportunity for public comment just at the end to respond, just very quickly?
Sure.
Okay. The only thing that I
Perry,
wanted-
come to the mic, though, because for the recording.
The only thing that I wanted to say was that the EQRO report this year discusses the crisis service level that we have in the county. And so we are very crisis-driven. We build these big buildings, we're building a PUF, we're doing all of these major components. But what we are lacking, which even with the cultural diversity, I hear that we're going to the tribes and we're building up tribal relations, but we aren't building service providers, which is where our lack is. And so my idea behind this is that if you have a big bang for your buck, you are still getting nothing if Ford Street doesn't have someone to discharge to in the community that will maintain that continuity of care. And so it's a system that we're looking at. That was my only reason. I'm not criticizing your logic behind your funding by any means whatsoever. I'm simply suggesting that you take a look at the entire approach from a strategic standpoint and take a look at Kemper, because that is what they suggested.
I'm not against you, and I support you, but I want you to know that even our Mendocino Community College, the past president, who's no longer here, had promised me personally that if Measure B passed, they would be starting a mental health technician course of study for certification, which they've yet to do. And so this committee has talked exactly about what you're talking about, because we understand you can't just help someone in emergency and then release them from the window and say, fly, you're free, without providing them the services that they need. So we know what you're saying, and certainly you've reminded us what we've spoken about before, but if anybody has any pull with Mendocino Community College on the coast or inland, we need that mental health technician certification course.
Absolutely,
We'll
I
have no
totally agree.
employees.
And Noel O'Neill would be, who is a board of trustee, has been working on things. I have to call him, I haven't talked to him in a while. But there are people that it's capable at the college level to build that.
All right, thank you guys, and I'm going to close the meeting. Thank you.